on an annual basis. And I can share. There is a very good map from Georgia University where you can see the people they can report hog week sightings. So I've looked into it. So there are only two sightings of giant hogweed in Haldimand and Norfolk. One is in Simcoe, and the other one is in Dunvale. But they still have to like investigate it. Thank you. Any questions?
Bernie, do you have anything?
Yes, if I may, you speak of giant hogweed. I ended up getting the rash from it, and we eradicated a number of plants, but it is prevalent. And just to let you know, GRCA is looking into it as well because it tends to flow down the river from the upper sources, and we're going to get it in our area as well. So just passing that information along, and hopefully we're prepared to deal with it with information going out in any case. It makes a nasty rash. It's like somebody took a poker to your arm. It swells up. In addition to that, you can be blinded by it.
Yeah, that's poisonous. And thank you for that information, Councillor Gorbick.
Okay, thank you. We'll move on to our reports then while we wait for Dr. Strauss. The first one is, sorry, Heidi.
Sorry, Mr. Chair, I don't mean to interrupt you again, but I do see that Dr. Strauss is with us, so we could go. We can move on to the Acting Medical Officer of Health report, including the COVID report.
Okay, no problem. Good morning, Dr. Strauss.
Good morning. I hope I wasn't late. I thought I was on time. We started at 9:30, right? So I'm having a harder and harder time coming up with exciting things to say in these COVID reports. As you're all probably aware, the case rate Ontario-wide has been going down. The burden of inpatient admissions Ontario-wide has been going down. I think that there's a consensus among scientific figures in the province that we are watching the end of the fourth wave hit our shores. Some folks have used or I should say, for many folks, the fourth wave was smaller than predicted. There are some exciting points of news. I have a media call later this morning that I'm excited to tell folks about. Hamilton, a former colleague of mine, Dr. Chagla, is an infectious disease doctor, and he is running one of I think the first infusion clinic in the province for monoclonal antibodies to treat COVID-19 infection. These medications are approved by Health Canada. There's nothing experimental about these medications at this time. They are hard to come by, and so his clinic is a pilot project, and he's hoping to show that it not only saves lives, but is cost saving to see if the province won't roll it out more widely. So the health unit is going to be working in the weeks to come to identify folks who are COVID-19 positive, who have significant risk factors, and referring them to that clinic. I should say that these medications cut the death rate in high-risk individuals by about 50%. So they are effective. They are not, however, as effective as the vaccines, which cut the death rate by in excess of 95%. So we still want everyone to get vaccinated. The fact that these exciting new medications exist, and they exist close to Haldimand, Norfolk, is not a reason not to get vaccinated. It is a reason to get tested, though. So if you are a high-risk individual and you have symptoms of what might be COVID-19, I think it is doubly important that you get tested now, not just so we can do proper case and contact management, but because there could be a life-saving medication available to you at the St. Joe's infusion clinic in Hamilton. So I will be promoting that going forward. Otherwise, just to say, I'm really pleased with our vaccination rate. So I think 6 weeks ago, we were 5th from the bottom in terms of public health units on the provincial vaccine tracker. We are now 15th from the bottom. So it might be time to start counting our position from the top, as we're not really anywhere near the bottom anymore. So we're in about the middle third, 20th from the top out of 35. I'm really pleased with that. I remain just marveled by all the amazing logistics work that folks at the health unit are undertaking, including, of course, Chief Page. So overall, I've said before that the fourth wave is not likely to be the last wave, but I think subsequent waves should be less and less mortal as treatments get better and vaccine coverage improves. So I think we have every reason to be hopeful and optimistic, even as we acknowledge that we've not seen the last of this disease. I'm very pleased to take your questions.
Okay, thank you, Dr. Strauss. I believe I saw Councillor Huffman first, then Councillor Corbett.
Thank you, Chair Del Monte. Through you to Dr. Strauss, I'm not sure if you would have these figures or not, but I know that the GoVax bus was at the Norfolk County Fair and that it was in Port Dover, not this past weekend, but the weekend before. Do you know what the uptake was on vaccines, people receiving them through the GoVax bus?
I believe that I heard a figure from its first outing here of 50 vaccines.
50, okay.
I'm willing to be corrected on that if anyone else on the line. I would hate to be misremembering, but I think from the Norfolk County Fair, the number was...
Then none.
I agree.
Councillor Corbett?
Yes, thank you very much, and welcome again. You will be addressing our council tomorrow, and I'm sure you will be touching on those issues that we dealt with earlier in the campaign, the seriousness of COVID, and there's some question coming forward with regard to vaccination mandate, Haldeman versus Norfolk. So just to give you a heads up on that.
Oh, through the chair to you, Councillor Corbett, I appreciate the heads up. Forewarned is forearmed.
Okay, thank you. And at this point, we'll move on to staff reports, with the first one being HSS 2118. It's regarding the annual service plan, budget submission, and funding update, budget amendment. Heidi, are you going to speak to that report?
Mr. Chair, the Director of Public Health, Stephanie Pongrass, is here this morning, and she's going to be presenting the report.
Okay, good morning, Stephanie.
Good morning, everyone. Thank you for the opportunity to speak with Advisory Committee on Report HSS 2118, the Annual Service Plan Budget Submission and Funding Update. The report provides information on the current public health funding and accountability agreement received on July 22nd, 2021, and requests approval of the funding received to amend the current operating budget. On April 1st of 2021, the Health Unit submitted our annual service plan. The plan describes our existing services planned as per the Ontario Public Health Standards and reflects programs that are cost shared and 100% funded by the Ministry of Health. The cost share is 30% for public health programs and services, with the exception of the Ontario Seniors Dental Care Program and the Medical Officer Health Compensation. The accountability agreement utilized for this service plan submission was received on January 5th, 2021, and included both provincial and municipal sources of funding. This year, due to increased demands regarding COVID-19 response, the ministry scaled back the 2021 submission template and only requested the public health unit's complete budget and financial sections and one-time requests for funding. The submission included no additional base funding requests and was limited to 6 one-time funding requests, which included the COVID-19 extraordinary costs and the COVID-19 vaccine program costs. Similar to previous years, the submission does not include the Healthy Baby, Healthy Children program funding provided by the Ministry of Children, Community and Social Services. A summary of the submission includes a base program submission of $8.9 million for 2021 within the existing Board of Health approved budget, and 6 one-time funding requests totaling $8.17 million. In 2021, of July of 2021, we received notification that for the 2021-2022 funding year, the maximum funding available under the agreement is up to $11,323,400. Table 1 in the report illustrates the 6 one-time funding requests submitted and the monies that we've received. With request number 1, we have now added this request to the 2022 capital budget, and this will not go forward unless approved by the Board of Health. With requests 2 and 3, the ministry has given an initial allocation as a percentage of our request, and the ministry is committed to fund all eligible COVID-19 costs both extraordinary for vaccine or for COVID response. And with request number 4, the ministry has also communicated they will fully fund that. Table 2 illustrates the base funding allotment received, which has remained the same as the 2020 calendar year allocation. And we also received additional one-time funding for 21-22 that was not applied for within the service plan. And this is found in Table 3 of the report. Of note, the ministry has committed that they will continue funding the COVID-19 school-focused nursing initiative into the 2022-23 fiscal year, with the program slated to end July 31st, 2022. And Table 4 illustrates the approved allocations and budgeted allocations with a total variance of $4,010,500. So to conclude, there are 3 recommendations for the advisory committee. The report HSS 2118 be received as information, that the approved 2021 Haldeman Norfolk Health Unit operating budget be amended to include this $4,010,500 in one-time funding, and that the Board of Health ensure that the delivery of one-time funded programs as outlined in this report. Thank you, and we can go to questions.
Thank you, Stephanie. Can I have a motion or a mover and seconder for the motion on page 10 to get it on the floor for discussion? Mover and seconder, please. Councillor Corbett's moved. Seconder, Councillor Taylor. Any discussion, questions, comments in regards to the report? I see no hands, so I'm going to call for the vote. All those in favor? Motion is carried unanimously.
Thank you.
We will move on to social services and housing. Report HSS 2119, Housing Services Operating Subsidy Agreement and Simcoe in relation to Lynnview Terrace.
Good morning, everyone. That's Stephanie Rice. I'll be presenting this report and the following report as well to committee. So through you, Mr. Chair, to the committee, the first report is the HSS 2119 in relation to a recommendation for us to move ahead with a new operating agreement for Lynnview Terrace, which is run by Simcoe Community Homes. Currently, Lynnview Terrace, which operates seniors housing in Simcoe, there are 56 units. 28 of these are rent. So under the federal operating agreement that they are currently under, we would be in a position to lose these units if we were to allow the operating agreement to end, as it is set to do so on December the 1st. Staff have negotiated with the board of Lynnview Terrace in order to come forward with a proposed draft agreement to operate under the provincial funding model. One of the components of this is the opportunity for Lynnview Terrace to be eligible for federal and provincial funding through this agreement with us, and it also allows us to maintain these units within our community, within the stock in our community. Finance has indicated that at current time, based on the fact that the mortgage is paid for this particular housing provider, there wouldn't be a subsidy impact. At this point, there'd be no levy impact. However, it does need to be recognized that this could potentially be part of that consideration for future. So in summary, we're working to maintain the units within our communities as much as possible. And one of the recognized ways that we're doing that across the province is to look at end of operating agreements and try to come forward with new agreements. If this agreement is moved forward and signed, we will have the units with us for at least 10 more years under the agreement. The agreement draft has been provided with the report, so I'm certain that you've gone through that and you see the parameters in place to protect those units and to ensure that our community maintains the level of service that it has right now. I'd like the questions, any.
Thank you, Stephanie. First of all, I'll ask for a mover and seconder to get the motion on page 44 on the floor for discussion. Mover and seconder, please. Councillor Huffman has moved. Seconder.
I'll second it, Chair Delmonte. Stu.
Thank you, Councillor Patterson. Any questions or comments in regards to the report or the recommendation? I see no hands, so I'm going to call for the vote. All those in favor of the recommendation? Motion is carried unanimously.
Thank you.
Move on to page 46. It's staff report HSS 2120 in regards to the Ontario Works Business Plan for 2021.
Okay, I will also be presenting this report. So thank you, everyone. Through you, Mr. Chair, to the committee. This report is for information at this stage. As you are all aware, our office is one of the prototype sites for employment services transformation, which began at the beginning of this calendar year. So in recognition that this is a new prototype and this is something that we're learning and growing with, the ministry has required that we present a business plan for the current calendar year, and that for next year we will have to move forward with a more formal service plan, as is the standard required information for the program operations. So what has been presented in the report is what would be presented to the ministry if it's approved by council in recognition of the service plan. It's already October, so the understanding from the ministry is that part of what we were to do is look at how we are managing the new targets, the new outcomes, and the new processes to identify what we would achieve in this new model. Again, recognizing a lot of it is transformative, so it's transforming our processes, making sure that our staff are trained and understand the new model that the ministry has given for us to operate within, and understanding that we continue to learn and grow as we move forward. Again, a full business or full service plan, my apologies, will be due in the first quarter of 2022, and it will be a more fulsome report for the ministry based on the full year of data. We don't have current data for some of the information that the ministry is asking for feedback on, and the understanding from the ministry is that we do our best to provide what we can. Recognition is that those data targets will be presented to us and available to us by the end of the calendar year in order for us to move forward with a more fulsome service plan for 2021. So as part of this report, essentially it is to recommend that it is accepted as information with the understanding that a more fulsome service plan will be brought forward to council in the first quarter of 2022. I'd like to open it up to questions if there are any.
Okay, thank you, Stephanie. I'll first ask for mover and seconder for the motion on page 50 to get on the floor for discussion. Councillor Corbett moves, seconder. Councillor Taylor, any questions, comments in regards to the report or the recommendation? I see no hands, so I'll call for the vote. All those in favor? It is carried unanimously.
Thank you.
So I guess we'll move on to item 10. So there's no communications. Councillor Corbett, you had an issue you wanted to raise here under other business. I think you're muted, Bernie.
Yeah, this learning process. The first one I sent out was with the transition from CERB payment, and everybody knows any place you go in the community, you see people wanting to hire people, and CERB has given some a guaranteed income for some time, and there is that transition period where they don't want to go to work. I wonder how it affects our employables. And the second, I thank Heidi for the update on the opening of the Dunvale office. I'd like to know, is the construction completed, and what services you are offering there? Thank you.
So thank you, Mr. Chair. Through you to Councillor Corbett. In terms of the question related to the CERB, internally, I would say that the CERB is not a factor in our internal recruitment efforts within the Health and Social Services Division. Where we are seeing pressures in terms of recruitment are in those positions where there are more broad recruitment pressures across the community, across the province, across Canada. So in those health human services, those health human resources, in positions like registered staff, nursing, public health inspectors, I know that it's not under the jurisdiction of this committee, but you know, some of those positions at Norview Lodge as well. And so I think that the pressures, the recruitment pressures that we face internally are not unique to us. And I think that there are a few factors impacting that. One is that right now, because there have been efforts across Health Human Resources to staff up, not just in public health, but in healthcare, that it's a highly competitive market right now for those Health Human Resource positions. And secondly, we know that there are people that are leaving the health and healthcare professions because of exhaustion and compassion fatigue that has come from COVID-19. In social services, the recruitments that we have ongoing, I would say, are indicative of an average year in social services. On average, we recruit 2 to 3 case managers a year, and that is because of general turnover. Some of those positions are temporary full-time due to leaves of absence, pregnancy, parental leave, I think are most of those leaves of absence, or quite frankly, our neighboring municipalities and social services pay higher wages. And so sometimes we have staff who come and start to work with us in their career, and then when positions open in some of our neighboring municipalities, then they decide to leave and go work there. So I think that I hope that answers your question internally. In terms of what we are seeing in our broader Haldeman Norfolk community, that's a little bit trickier to answer because Ontario Works does not deliver employment services anymore. Part of the employment services transformation is that those employment related services got shifted entirely over to our employment service system manager and Employment Ontario. So we don't have the same level of data available to us related to employment that we used to. Where we'll see the greatest impact is on our Ontario Works caseloads. So when the federal benefits end, we are preparing right now for a surge of intakes in Ontario Works. So I can't make the connection between the what is happening externally in our community in terms of employment and the issuance of federal benefits.
Thank you for that overview. You touched on long-term care and providing employees. What is happening with the increased funding that's come from long-term care and the additional staff that is going to be required? Are you aware of that? If you're having difficulty recruiting now, you're even going to have more problem recruiting when this funding comes.
Thank you, Mr. Chair. Through you to Councillor Corbett. Yes, I am aware of the additional funding in long-term care. I can't speak to the plans that Grandview Lodge has. That would, because Grandview is outside of the Health and Social Services scope. So that's specifically Haldeman County, and Norview Lodge is specifically Norfolk. But yes, when I can say that when there are positions open, whether it's in the health unit, whether it's in social services, whether it's in any of our departments, we are actively recruiting, and so, you know, we'll do our best. That's the best I've got today in terms of, like I said, it's a competitive market right now for healthcare professionals because everybody is in the same boat in terms of recruiting.
Thank you very much.
So, Mr. Chair, the next question was related to the Dunvale office. So yes, the Dunvale office is open. The construction has been completed. The renovations are completed. The office is beautiful and highly functional, and we are very pleased with the renovations. Through the renovations, we have been able to make some significant health and safety upgrades for our staff, including plexiglass barrier for reception. All of our staff are now working behind locked doors that have swipe card access, similar to here at the Gilbertson office. And we have a room at the front where we will, when we're seeing clients in person again, for our high risk clients, that has a plexiglass barrier between the client and the staff in order to improve health and safety. So that is significant. I think the one thing that is still being finished, perhaps either Ms. Pongrass or Mr. Okoronkwo can comment on, is the dental suite. I think that that's the one piece of work in Dunvale that we're still finishing up. But other than that, it's completed. And I see that Stephanie has her hand up, so I'll pass it over to her.
Thank you, Heidi. Through the chair to Councillor Corbett, I just wanted to mention that the dental suite is now completed, so we're good to go. And part of the plan is that we'll start resuming some services a couple days a week there for the dental suite. So those planning and those plans are underway.
Thanks, Stephanie. And I will just share that we are actively working on starting to finalize and implement the very first phase of our recovery plan, and part of that is also we're continuing to have discussions related to when we can open the Caledonia office. So we've started with Dunvale and getting more staff rotating through Gilbertson and Simcoe, and then also getting staff back to Caledonia. But that really depends on where we are in the recovery process and what is going on with COVID response and vaccinations.
Okay, thank you, Heidi. Heidi, is there anything else for committee's attention this morning?
Mr. Chair, I just wanted to speak to Councillor Corbett. In his email had one other item related to the alternate average market rents. So I just wanted to speak to that and provide committee with an update on that item. And so, as was directed at the last advisory committee, the housing and homelessness staff have put out a request through our provincial housing and homelessness network to all of the 47 consolidated municipal services managers across the province to ask who has implemented an alternate. So we asked 3 questions. Have you implemented an alternate average market rent? Secondly, have there been any impacts on your centralized wait lists or homelessness in your community that you can connect to that? And third, does your municipality have municipally funded housing allowances or rent assistance benefits in order to deepen the affordability for people who need them? So we have received 2 responses so far, and then Councillor Corbett referenced Stratford as well, and I did read that article. The commonality between those 3 responses are that they have all implemented alternate average market rents. Stratford just did it. The other 2 municipalities, Halton and York, have been using them for a while, and all 3 municipalities so far have additional municipally funded rent supplements or housing allowances that they use to provide deeper affordability to those who need them. I will also share with committee that we are reviewing the report, and we're looking at various options. I've had conversations with senior leadership of counties, and the report will be coming back to the November for your consideration and for including the additional information and analysis.
Okay, thank you, Heidi. So I take it there's no other items here for committee's attention. So our next meeting is November 22nd. So can I have a mover and seconder to adjourn this meeting? Councillor Huffman? Councillor Huffman, you're
Sorry,
muted.
I have just one quick question.
Sure, go ahead.
Okay, I was just wondering, Heidi, if you could please make sure that I'm contacted in regards to the homelessness enumeration. I had expressed an interest in being a part of that, and I know it's coming up in November.
Yes, absolutely, Councillor Huffman. Thank you. I did pass that information on to our homeless prevention staff. I see that Ms. Rice has noted that, and
Okay.
we'll follow up with the staff after the meeting to make sure you're contacted. And thank you for volunteering.
All right, great. Thank you.
Okay, can I have a mover and seconder for the motion to adjourn this meeting? Councillor Huffman's moved. Councillor Van Patten has seconded. All those in favor? Great. Motion's carried unanimously. Have a great soggy day. Take care.